Hi everyone, my name is Megan Tarvis, and I'm going to talk to everyone about non-invasive prenatal testing and sequential screening. So we're going to start with talking about sequential screening, which we will talk about later. Women who are identified at risk after their first trimester screening, prenatal testing will be offered to them, these individuals, in different avenues. Non-invasive prenatal testing basically is a diagnostic test that is non-invasive to detect any chromosomal abnormalities within the fetus. Basically, the key word is non-invasive, so it can't hurt or damage the fetus versus like an amniotic fluid test, chronic valley sampling, amniocentesis. It's a very low risk testing. And the history went back from it. The United States began to use this testing in 2011 to detect Down syndrome in fetuses by taking the cell-free fetal DNA from the mom. So basically, fetal DNA that was circulating in mom, they take a blood test and they obtain the DNA sequence. Non-invasive prenatal testing is now global testing in pregnancy, and it's used throughout the world. It's becoming more popular and accurate for pregnancies. Indications: this prenatal testing can interpret pieces of DNA, like I said, within the bloodstream to obtain any chromosomal differences or abnormalities. The indications basically detect trisomy 21, 18, or 13 in the early stages of pregnancies, basically to give information to the parents as well as giving them a choice whether to terminate the pregnancy or continue. This test can also detect monogenic diseases, basically abnormal genes, autosomal recessive, X-linked recessive, Turner syndrome, Klinefelter syndrome, or XXX syndrome. Of course, with every testing, there are some contraindications. Women who are less than 10 weeks will have a lower amount of this DNA in the maternal blood. So we don't want to screen anyone below 10 weeks because it won't be as accurate. Maternal weight can also affect the amount of DNA in the body. If you have a heavier weight, the concentration will be higher. The DNA is also found in the placenta villi. False positives can be created if that exchange isn't going on in the villi between the fetus DNA and the maternal fetal DNA. This testing can also have false positives and negatives. It's not a definitive test. Therefore, sequential testing is often offered after the first trimester. So the procedure for the test is pretty simple. Again, it detects genetic abnormalities. Test is after 10 weeks gestation. You want to make sure their gestational age is after 10 weeks. And the mom will basically get her blood drawn to analyze that gene sequence. Some advantages: you can detect fetal genetic abnormalities in early on pregnancy to give the parents the information, as well as the provider to decide how to care for this pregnancy. There's no harm or risk to the fetus during this test, versus like an amniocentesis where we know there's risk and benefits towards those, the amniocentesis. And we know there's a low number of false positive rates, which is good because this test is pretty much most of the time accurate. Testing reduces invasive testing, as we mentioned. And then we also found that 99% of positive trisomy 21 pregnancies can be detected from this testing. So it's very accurate, which gives us a better understanding. What's great about this test too is we can also obtain the sex of the fetus from 10 to 13 weeks. As you know, some women find the gender of their baby out early on in pregnancy, their first trimester, and this is the test that basically detects it. And of course, there are disadvantages with the testing. Sometimes you can get inconclusive results, which can make it difficult for interpretation. They may have to do a repeat testing. Can have false positives and negatives. Some of the false positive indications can be from a demised twin, maternal cancer, maternal mosaicism, placental mosaicism, a recent blood transfusion. So blood that's not yours is getting DNA, collecting the wrong fragments of DNA. Or it can be just a laboratory test issue. And it also doesn't test for every genetic syndrome. It may need further testing, like, for instance, cardiac issues. So interpretation, what's a normal finding? Results are negative. If you have results are negative, no further testing is needed at this time. You're going to continue your pregnancy and begin second trimester testings. Abnormal, if chromosomal deletions or duplications are detected, you may need further testing to obtain that diagnosis. So they may need a placental villi or the amniotic fluid testing, those invasive testings we talked about earlier. Genetic testing and counseling is needed for when the results are positive. Again, this testing is not definitive, so we need those other follow-up tests to confirm a diagnosis. So of course we want to teach and counsel our patients because it's a difficult, sensitive test. We want to recognize who's at risk for high-risk pregnancies. Any woman who has a family history of maybe Down syndrome or Turner syndrome, we're gonna definitely want to do this test. Maternal age, if they're older than 35 years old, they're more at risk for Down syndrome. Previous abnormal screenings or a previous abnormal ultrasound as well. So we want to offer sequential screening, as I mentioned before. It's offered with two options. We have stepwise, and that's the first trimester screening is at risk or below that threshold level, which can receive additional screening in the second trimester. Contingent is dividing women by categories, high, moderate, and low. High risk will definitely receive that genetic counseling and further screenings. Moderate will continue their second trimester screenings, and low, no testing is indicated at that time. And we also want to remind patients that screening is always optional and patients have their own autonomy to make their own decisions. So their decision's always made by the patient, whether what they want to do with their pregnancy. But we want to also provide emotional support during this difficult time. And testing takes time to interpret results. So I want to educate patients that it might take longer to get those results back to reduce that anxiety, usually around 5 to 10 days. And that's it. Thank you for watching.